Hi, I'm Linda Douglas. I'm the Communications Director for the White House Office of Health Reform. And one of my jobs is to keep track of all the disinformation that's out there about health insurance reform. And there are a lot of very deceiving headlines out there right now, such as this one. Take a look at this one. This one says, "Uncovered video. Obama explains how his health care plan will eliminate private insurance." Well, nothing could be farther from the truth. You know, the people who always try to scare people whenever you try to bring them health insurance reform are at it again. And they're taking sentences and phrases out of context and cobbling them together to leave a very false impression. The truth is that the president has been talking to the American people a lot about health insurance reform and what is at stake for them. So what happens is that because he's talking to the American people so much, there are people out there with a computer and a lot of free time. Hi, I'm Linda Douglas. I'm the Communications Director for the White House Office of Health Reform. And they take a phrase here and there, they simply cherry pick and put it together and make it sound like he's saying something that he didn't really say. Now, for example, here's a clip that they probably won't show you.
I happen to be a proponent of a single-payer universal health care plan. That's no reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately. Because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
And here's another one.
I'm joined now from Chicago by Dr. David Scheiner. He was President Obama's doctor from 1987 until he entered the White House. He treated Obama for 22 years, but has publicly opposed Obama's health plan, calling for single payer.
The problem overwhelmingly is the issue, in my mind, of the private insurance companies being a part of the program. Their record has been so abominable that to have them in the program just doesn't make sense. Ezekiel Emanuel, Rahm's brother, made a comment in the Journal of the AMA that just the administration costs of employers' health is over $300 billion a year. And that money will still be wasted. There'll probably be even more advertising. The huge CEO salaries will continue to be made. I think the head of Aetna makes $23 million a year. Insurance companies repeatedly interfere with the care of patients. The opponents of health reform keep saying that if the government gets into medicine, you won't have a choice of your doctor, you won't have the choice of your hospital, your care will be restricted. I don't know where they got Medicare. If anything is too permissive, Medicare never gets in my way. But insurance companies, I have to use special labs. I can use certain hospitals for one person. I can't use them for another. I'm repeatedly getting responses from the insurance company disallowing certain procedures, disallowing certain medications. The insurance company is in the room every time I see a patient, and somehow the patients think they have free choice. Medicare gives them free choice. They will have their choice of doctor. They will have their choice of treatment. With private insurance, that will not be the case. It's an extraordinary waste of money. And the public, if I had a single point to make about what is going wrong with this health reform, is that the public is so uninformed.
During the August congressional recess, the members of Congress are going to be back where the health insurance reform debate matters most, and that is in neighborhoods and communities where people are struggling with high health care costs, where people are facing unfair insurance regulations that deny them the health care that they need, where people are really seeking some kind of stability and security that will let them know that there will always be health care available for their families. The country's been waiting for decades for action, and we are not going to let them down this time. So it's very important for you to have the facts. The clip that you just saw is available on as are many of the president's statements and speeches. You should take a look at that, see what the president is really saying about health insurance reform and how it affects your life. Thanks very much for joining me.